Transition to registered nurse. Accountability and responsibility. The increase in newly qualified nurses' responsibility and accountability is a major stressor in the transition process. Responsibilities can be subdivided into management, delegation, drug administration, and prioritising. Nurses need to be aware of and practice under their code of professional conduct and scope of practice. Management. Management skills of newly qualified nurses are a major area of concern. Ward managers' expectations of newly qualified nurses can be unrealistic. There are many pressures on the ward environment. Newly qualified nurses must adapt and integrate quickly, and the added responsibility of accountability can be overwhelming. While theoretical knowledge is often adequate, practical aspects such as drug administration, prioritising, and decision-making are often variable. This is attributed to the differences each practice placement offered the participant, so varying individual experiences and abilities. Delegation. While handling a caseload of patients, it may be necessary to delegate some tasks to other colleagues such as a healthcare worker, another nurse, or a student nurse. Scope of practice guidelines must be considered when doing this. Drug administration. A major cause of anxiety during the transition is drug administration. Before qualifying, student nurses had carried this procedure out only under supervision of a registered nurse, but were expected to practice unsupervised following qualification. These concerns suggest this area of practice is not adequately addressed during education and preparation of nurses. Prioritising. Newly qualified nurses must prioritise their own care as opposed to following instructions of a preceptor or a more senior colleague. Patient safety must always come first when prioritising. Coping strategies. As a direct result of not feeling adequately supported, some newly qualified nurses learn to cope with being thrown in the deep end. This is a significant turning point for newly qualified nurses as it may help them to develop their analytical skills and boost confidence. Other evidence suggests introducing a mandatory preceptorship program would assist with a smooth transition.
Created using Powtoon.